the healthcare to healthcare event, we just finished a cybersecurity session, which as a CIO, I always got angst every time I sat. And I've sat through some interesting ones, like NSA people like telling me what's going on. I'm like, I went home crying, and my wife's like, "What's wrong? Let me put my arm around you." I'm like, because it's a scary world out there, and these CIOs are dealing with some serious stuff. What's your takeaway from like some of the things we've been hearing about cybersecurity today?
Yeah, so I'll start. I mean, obviously from healthcare, ransomware is always the top of the list. And I always like to go backwards up the chain as well. So I was at Cone Health. Phishing was always that entry point. So you're obviously trying to make sure that you have your defensive depth strategies kind of in place to be able to handle and remediate the ransomware, but you also want to go back up to how did it initially come into the environment, which is again, phishing. So we really have to take that broad look and make sure that you have really governed process for recovery, and that's the one that I don't think everyone's prepared for, because it could go all the way down into just communication. How do you communicate with your patients, the community? I mean, brand image, there's so much to it nowadays.
Are we testing that from end to end? I know we do tabletops and those kind of things, but I heard of one organization, they had everybody at the tabletop. I mean, it was marketing was there and operations was there. I mean, you name it, they were all there sort of going through it. And I think that's a new phenomenon really, unfortunately, in healthcare. Are we seeing that go on?
Yeah, so I think we are, and from what I've been with Sirius, they're definitely pushing that, because again, it really is a whole team. It takes the whole team to really respond to an event like that. The last tabletop that we did at Cone Health, what we had done is we had everybody at the table, but kind of try to still split it, because you want to know that you have a technical response. So we run through the same event, but really focused with the technical responders, and then brought in the leadership, marketing, things like that, and did the exact same response to try to not get bogged down into the technicalities of how are you responding, more of, well, internally, how are we continuing with operations, communication.